பேரெல்லாம் மறந்து போச்சு அது கிரீம் கதவு தட்டினேன்.
Okay. So liver, as we all know, it's a mini chemical factory that is located in our body. And it's a very, very vital organ, having multi-various roles, different functions. We will see individually what are the functions as per the modern medicine. The liver is involved, and also as per the TCM perspective, how it is being looked into, and what are all the various patterns that are associated with the liver, and also some common points, because we advise the students not to go with any ready-made points. General points only will be discussed here, as the points, the treatment protocol points would vary significantly based on various factors like the pattern, the chronicity, the age, the condition, comorbidity, and so many other conditions. So at the end that we will see that also. So the liver is a vital organ which is located in the upper right abdomen beneath the rib cage. So right upper quadrant in the abdomen. So it is the largest gland in your body, and it's a reddish brown in color, having wedge shaped one, and it does more than 500 essential functions. Very complicated physiological activities that are being controlled by the liver, starting from filtering the toxins, producing bile for digestion, regulating the blood sugar, and synthesizing proteins. We will see briefly about all those activities, because if we get into individual aspects like filtering toxins, that alone would take at least 1 day, not 1 hour. Similarly, involvement of liver in the digestion, production of bile, composition, how the hepatocytes for various digestive functions, how it uses various components of the bile, all those things, and also regulating the blood sugar. So that means when it is needed, it produces neoglucogenesis, and when it is not needed, it reserves excess glucose in the blood, the form of glycogen, and it stores. So it's another huge topic. And then synthesizing proteins, albumins, globulins, all those things. So first we will see the anatomy, and then we will see the physiology, and then various diseases that are associated with the liver. With regard to the location and size, as I already told, it's the largest internal organ in the human body. Internal organ. Internal one is the skin, and internal is liver. And located in the right upper quadrant of the abdomen, just beneath the diaphragm. And partly, we cannot be fully protected by the rib cage, partly protected by the rib cage. And this weighs about 1.4 to 1.6 kg in adults, and roughly 15 centimeters long in adults. why it is necessary for us to know about the size, weight, all those things? Yes, because a fatty liver or hepatomegaly, that means inflammation, swelling of the liver, unless you have a brief idea about what is the size of the liver, you cannot make out when you read the uh, scan reports. That's why I've given the weight and size and all that. And reddish brown in color. The color will change. Normally, in a healthy person, the color of a liver is reddish brown. And this reddish brown is because of its rich supply of blood. So the liver has got two major surfaces and four lobes. With regard to the surface, one is diaphragmatic, which is smooth and convex, facing the diaphragm upside, the top area, superior area, and the visceral surface, which is concave and in contact with the abdominal organs like stomach, kidney, duodenum, and colon. With regard to the lobes, there are four lobes. That is right lobe, that is the largest one, and left lobe. Then inside beneath, that is caudate and quadrate. There are two small lobes. Total four lobes are there. And function divided based on the blood supply into right and left functional lobes mainly. And with regard to the ligaments, ligaments are the attachments that makes the liver to be in its place, hanging there in the abdomen. So it is attached to its surroundings by the ligaments or peritoneal folds. One is falciform ligament, which divides right and left lobe, and then a round ligament or ligamentum teres. This is the remnant of fetal umbilical vein. And then coronary and triangular ligaments, which anchor the liver to the diaphragm.
Sir, sir, sound is very low.
Very low.
Yeah.
Is it okay now?
हाँ
What better?
थोड़ा सा हाँ अभी ठीक है अभी ठीक है
ठीक है.
Yeah.
And the lymphatic and nervous supply. This has got rich lymphatic drainage, because this involves in complete detoxification activities, and it does a lot of physiological activities. So it is having a rich supply of nervous system, lymphatic, and also the blood vessels. And it has got the connections of both the sympathetic as well as the parasympathetic nerves. And the blood supply is, majority of it is from the hepatic portal vein. That carries the nutrient is fled from the GI tract, and the hepatic artery, which supplies around 25% of the total blood supply. Liver is the one that supplies the oxygenated blood. So hepatic artery that carries the oxygenated blood from the heart to the liver. The blood leaves the liver via hepatic veins. and gets into the inferior vena cava, and then it enters into the right atrium of the heart. This is in brief about the anatomy, the location and all. Before coming to the histology. Histology is about the cell structure. Before that, we will see some detailed pictures from the book of B.D. Chaurasia. So the rib cage will be just going like this. So it is not fully covered. A bit of it will be out of the rib. In the abdominal diagnosis, this area only we will be palpating to understand any condition related to the liver, mainly gallbladder. This is gallbladder as per the abdominal diagnosis. Spleen or pancreas at the same level, just below the rib cage. This area we will check. Right and left lobe, these are all the major lobes. This is the caudate lobe. And through these ligaments, it is attached to the diaphragm and also the temporal area, and it is kept at its position. So this is the front view. From the front view, you can see mainly the right, this is the bigger one, right lobe and left lobe, which is separated by this falciform ligament. And this is the diaphragm. So this triangular ligament that is attached with the diaphragm that connects the liver and the diaphragm. This is inside view, so that you can see all the four lobes. So this is the left lobe. This is the left lobe. This is the right lobe. And this is the caudate one. And this is quadrate one. The gallbladder is almost located adjacent or just the base of the liver. You see the portal vein. This is the one which carries majority of the blood supply. Ligament of vena cava through this, the blood is brain, it reaches to the heart. It enters the right atria and it gets into the lungs. That is right atria, then right ventricle, then pulmonary artery, and then to lungs from liver. Inferior vena cava. From that it enters into right auricle, and then
Sir, your voice is still very low.
Yes, sir. Voice is low, sir. Increase the voice or increase the volume.
is full. Is raised to full. I don't know why.
Maybe you should come a little closer. Maybe, I don't know.
Closer to the mic.
Okay. I give
It's
an
audio feeble. It is coming.
very feeble, huh?
Yeah.
Now better?
We have to just put our ears to the screen.
Oh, I'm sorry. Is it clear now? Somewhat better now?
Yeah, now it's okay.
Okay. So this is about the arteries, blood supply, and also the bile supply. The bile secreted by the hepatocytes are collected and enters the CBD, that is common bile duct, and then it enters into the duodenum after it is stored in the gallbladder. So these are all the segments of the liver. That is anterior, superior area, depending upon the location, they are mentioned here, like anterior superior, anterior inferior, and also the ligaments and all. Just to give an idea about how anatomically it is placed or located. This is the anterior and posterior view. The shape may be any of these. Need not be always, it will be like, need not be. Sometimes this lobe, the left lobe may be smaller one, very smaller one compared to the right, or the area at the inferior end. Here the gallbladder will be there. This may be so concave. And at times this may be like this also. You cannot say that they are malformed or having some defects. Need not be. Need not be. When we come back to the histological structure, this is made up of functional units called lobules. Each lobule is hexagonal in shape. Central vein is located at the middle or the center, which is surrounded by the portal triads. And then hepatic artery, portal vein, and bile ducts. Hepatocytes are the cells of liver, are arranged in plates around a central vein. through which only the secretions of these hepatocytes are drained. And the sinusoids or the capillary spaces between the hepatocyte plates, in between that is intercellular. And Kupffer cells are specialized macrophages that is lined in the sinusoids that clear debris and microbes, Kupffer cells. And the bile caliculi. Canaliculi is the tiny ducts, canal, that collects bile from the hepatocytes and are collected and drained. That is in brief, very brief about the anatomy of the liver. Then physiology. As we have already seen, it is involved in more than 500 different types of activities. So that is categorized into various metabolic activities, like carbohydrate metabolism, lipid metabolism, protein metabolism, and then the detoxification activities, bile production and secretion, then storage, immune function, hormone and enzyme regulation, synthesis of coagulation or blood clotting factors, because this involves in the blood clotting activities. So these many metabolic functions are performed by the liver. So if you take first the carbohydrate metabolism, it is involved in the glycogenesis, that is converting glucose to glycogen. So when the blood is having excess of sugar, which is not required body to be, which are not required by the body to be utilized immediately, so that reserves, that glucose is converted into glycogen and stored here. So this is glycogenesis, not glucogenesis. This is glycogenesis, where insulin is involved in this. It is a metabolic activity wherein the glucose is converted into glycogen and reserved, stored in the body. It is stored in the liver and then in the adipose tissues. So when the body is in need of any energy supply, which it is not getting through the food, then it demands from the liver, that is the glycogen reserve, through the sympathetic nervous system activation, using glucagon. Glucagon is the hormone involved in that. And in glycogenesis, it is insulin. Both glucagon and insulin, both are secreted in pancreas only. Insulin is secreted from the beta cells. Glucagon is from the alpha cells of pancreas. So the autonomous nervous system, ANS, autonomous nervous system, which is having sympathetic and parasympathetic nervous system. So the parasympathetic is this one, that is glucose to glycogen. It is the metabolic activity, whereas the sympathetic activity that stimulates or it stops production of insulin and stimulates the production of glucagon, which converts this glycogen into glucose. It is a catabolic activity. Thereby, it regulates the blood sugar level. It maintains whenever the body has to perform various functions, mainly the motor functions, other than normal metabolic activities. When it requires sudden higher level of energy, glucose, then immediately the sympathetic gets into action. So the liver controls by regulating this entire activity. That's why if a person is diabetic, before looking into the pancreas and then to spleen, first we need to check the liver, both as per the modern medicine as well as the TCM, because in TCM, liver controls the, or the wood element controls the earth element under the controlling cycle, the flow. So if liver dominates the earth, then the spleen and stomach will not be in a position to perform its normal activity, and that will lead to improper digestion, that will lead to the sugar level, excess of sugar level in the blood. So that is called glycogenesis. The second one, glycogenolysis. Lysis means destruction, which is the reverse action, or neoglucogenesis. So the first one is parasympathetic activity, second one is sympathetic activity. Then lipid metabolism. Liver is involved in the synthesis of cholesterol, and then lipoproteins and phospholipids.
Somebody is not in mute, sir.
So whenever you come across that a patient who is having cholesterol issues, higher cholesterol and also triglycerides, instead of resorting to statins are cholesterol lowering drugs used in modern medicine for all the heart patients, CAD patients, coronary artery disease patients, and also all the stroke patients, especially ischemic stroke. There are two types of stroke. One is ischemic, another one is hemorrhagic. Ischemic is because of block, maybe due to atherosclerosis or due to embolism or thrombus or thromboembolism, whatever it is. Net, it is the block. So what they do, they lower the cholesterol level and make the blood thinner so that it can pass through the narrow passages in the capillaries. But we are not looking into the liver, which is actually controlling the lipid metabolism, the cholesterol and other things. You see the cholesterol, it is almost 80% of the cholesterol is made by the liver from carbohydrates and only 20% from the fat, oily, and other items that you take. That means if you have excess cholesterol, what you need to look into and address is the carbohydrates, not the fat, not the chicken or mutton, but the rice that you are taking along with it. In case of non-veg, for vegetarians, similarly, other items. So it is not the oil or the ghee or butter or whatever the other fat items that you consume. It's not the major culprit, but the carbohydrates. So the liver governs what is the level of various lipids, that is LDL, HDL, very low density lipoprotein, all those things. So depending upon the signals it is received through various neurotransmitters in the body, it produces the different levels and different compositions of the cholesterols and lipids. So when you see the cholesterol or the triglycerides or the composition of LDL and HDL, that is LDL from the liver to the body and HDL is from the body to the liver, the passage. So you have to address the liver and the condition which triggers the liver to produce more LDL or HDL or the triglycerides. So our approach must be in toto. It's not that just on one aspect alone. Then it becomes a symptomatic one. It's not a one that is addressing the root cause. For example, if there is a problem in the blood vessel, say for example, the blood vessels must be highly elastic. That means when the blood flow required by the body is more, that means due to some heavy, fast motor functions, that means you need to run or you have to lift some weight or you have to perform some activity which requires more blood flow, then the volume of the blood that flows through the arteries will be more. At the time it has to expand in certain level so that the pressure is maintained at the same level, not varying much. And this is mostly happening when the a sympathetic activation is more. So when you are in a resting mode, you are sleeping or resting or not much of the physical activity, only metabolic activities are happening in the body. For that, the blood flow required by the body, the organs as well as the limbs and visceral organs and all is less. So when the blood flow through the artery is less, then it will again shrink to maintain the same level of BP. That means it must have adequate elasticity to expand or constrict. This expansion and constrictions are controlled by various other organs and mechanisms. That is involving autonomous nervous system and also the organs like kidney and all, where the angiotensin, renin and all involved, which actually constricts. If magnesium is there, sodium is there, and calcium, these are all involved in the expansion or constriction activities. There are different channels. That's why you will have beta blockers or calcium channel blockers like that to address the issue of the BP, regulating the BP externally. So when the arteries are not having this kind of flexibility over a period of time due to various reasons. So what happens when the blood flow is forced to be more? It forms minor cracks. As soon as the cracks are formed, again immediately the neurotransmitter informs the liver that there need to be a plastering mechanism to cover the cracks in the blood vessel so that the blood will not leak out or seepage or move out of the blood vessels through these cracks. So in order to plaster that area, it produces the cholesterol and sends it there, and the cholesterols are getting deposited there, that is getting smeared there in order to avoid any kind of leakage of the blood getting out of the blood vessels. So here, over a period of time, slowly, these arteries are getting clogged and the passage becomes narrow. As already the blood vessels have lost their elasticity, further they don't expand. So the passage becomes narrow and narrow, then it becomes atherosclerotic condition and leads to various other conditions like CAD or stroke or whatever it is. So the liver responds to these neurotransmitters from various parts of the body like that. I have just given one example for the synthesis of cholesterol, lipoprotein and phospholipids. Because it's a vast one, just with regard to the cholesterol, I want to give an outlook about it. So lipoproteins and phospholipids, wherever it is needed, they produce. And then beta oxidation of fatty acids. Fatty acids or the micro units of fats, like how amino acids for the protein. So it involves in the beta oxidation. Again, the beta oxidation process is a lengthy one. Just you get to know about the beta oxidation is controlled by the liver. And then it converts excess carbohydrates and proteins into fatty acids and triglycerides. Thereby it maintains various levels of the cholesterol and triglycerides and regulates the carbohydrates and proteins that is taken by the body from the food. That is a lipid metabolism. Then comes protein metabolism. Here the deamination of amino acids and urea synthesis from the ammonia, that is from the protein sources, whatever the protein that you take. Because the protein and lipids, whatever that we eat, are digested by the liver only, the secretions of the liver. And then they synthesize the plasma protein in the blood, that is albumin, globulin, and then clotting factors, which are involved in blood clotting. Then detoxification, we all know that whatever the toxins that is there in the body, through the food, water, or other toxins, metabolic waste that are produced in the body are detoxified here, whether it is from the food or the water or liquids that what we consume, or the drugs, alcohol kind of a thing, and metabolic waste. For example, the bilirubin, it's a metabolic waste. Bilirubin, which is a byproduct of hemolysis. That is when the blood vessels are broken down by the spleen. Normally, the RBC stays for around 120 days in the body. After that, they are destroyed by the spleen. In this destruction process, it produces bilirubin. It's a toxic waste, which is detoxified by the liver. If the liver is not in a position to detoxify that, and then only we are getting the condition called jaundice, which normally an indication that the liver is not functioning properly. If it is functioning properly, then automatically it would have detoxified it. Like that, so many other ways are there which are handled and detoxified by the liver. And it makes them into a less harmful one and excretes, sends them out of the body, either through the stools or through the urine. And they contain an enzyme called cytochrome P450 enzyme for the drug metabolism. And then bile production and secretion, that is involved in the digestion. Almost half a liter to 1 liter of bile is being produced every day by the liver. So this helps in breaking down the protein and the fat in the food that whatever we consume, and it helps to break down then the fats and protein into fatty acids and the amino acids, and then further processing of it and then conversion into various items which are happening there in the small intestine, because the draining of the bile juice is into the duodenum only. This is the first part of small intestine. And then excretion of bilirubin, cholesterol, and other waste products. So that is secretion, bile production and secretion. Storage functions, it stores various vitamins like A, D, E, K, and B12. If you see any deficiency or decrease in the level of these vitamins in the body, instead of immediately jumping into supplements or external sources, you first look into the liver, how it is handled there in the body, how it is stored in the body. That is bioavailability. It's not that how much you are taking from various sources, but how it is being assimilated, taken inside the body. That is very important. Already we have seen that glucose is converted into glycogen stored here, energy reservoir. And then this also stores the iron and copper. And it stores blood also. So this acts as a reservoir of the blood. With regard to the immune functions, already we have seen that Kupffer cells, they destroy part of the old RBCs, then bacteria and foreign particles and drain them away. And it plays in the innate immunity. There are two types, acquired immunity and innate immunity. Acquired one is from externally given one. So antibiotics and other things, external sources. Innate is within the body, it is produced. So the liver involves in the innate immunity. Then hormone and enzyme regulation. So already we have seen that the hormones, it activates the hormones like insulin, glucagon, cortisol is the hormones that are related to sympathetic one. Norepinephrine, epinephrine and all cortisols. So adrenals are producing the adrenaline. Adrenaline is a cortisol hormone. So thereby that is the liver is influencing the kidneys also. We all know that the adrenal glands are located top of the kidney. This is the kidney like a cap. This is the adrenal gland. It is directly influenced by the health of the kidneys and vice versa. Any problem related to the adrenal glands will also affect the kidneys, or the problems related to the kidney will also affect the adrenal glands. The adrenal glands produce the cortisol, adrenaline. What as epinephrine and norepinephrine. These are all the neurotransmitters related to sympathetic. Acetylcholine is parasympathetic one. So this insulin, glucagon, cortisols, all those things. That is both sympathetic as well as parasympathetic of the autonomous nervous system are influenced by the liver. So a person who is having any problem in the liver, we'll have to look into these angles also. For that reason only, I am just coming to say all these details. Because it's not that liver is involved only with regard to liver. So every organ is having connections with the other organs, but liver is having direct influence to almost all the organs through this ANS. So this liver activates the vitamin D. Of course, kidneys are also involved in this, and estrogen is also involved in this. Estrogen is also controlled by the kidney, even though the estrogen is produced from the ovary. Ovary is controlled by the kidneys. The water element organs, kidney, urinary bladder, ovary and uterus. These are all the water element organs of women, female. In case of male, it is kidney, urinary bladder, prostate, and then testes. Liver supplies the blood to the uterus. So, if the ladies are having any problem in their menstrual cycle, that is menorrhagia or amenorrhea, that means no period at all or continuous flow of blood. Menorrhagia is continuous flow for long period. Instead of normally around 3 to 5 days, it goes for 10 days, 15 days, even for a month and all. Menorrhagia. So, along with uterus, we need to look into the liver also. The ovaries performance. If a lady who is having PCOD issues, they will have the problems of insulin resistance and then diabetes, and then they have the influence on the insulin, which is impacting the liver and the glycogen reserve. So all are interrelated. We need to understand them. And then this produces, liver produces angiotensinogen. It is a long process. Renin, angiotensin, one system is there which controls the BP involved in kidney. For that, the angiotensin is produced based on the precursor produced by the liver, that is called angiotensinogen. So when you are looking at kidneys, you will have to look into the liver also. As we all know, this is Panchabhuta: fire, earth, water, metal, water, and wood. So here is the liver. The problem related to the liver are not only the liver's problem, but we need to check into the water one. That's what I was telling about the kidney here. If the kidney is having any problem there, automatically it will reflect in the adrenals or the cortisols. Sympathetic automatically stimulates the liver. That is as per the modern medicine. Here, as per the TCM also, the water element kidney, any problem, for example, indeficiency of kidney will definitely impact Chi, and indeficiency of kidney will definitely impact the in level of the wood or the liver, where normally we will see the liver fire flaring up. This is the generative cycle. Under the control cycle, if you see, this is what I was talking about initially. If the liver is excess and it dominates the earth, the spleen, the digestion will get impacted. So instead of treating at SP, for example, SP3, ST36, SP6, ST40, all those things, instead you will have to look into liver also. Liver 3, without touching this, if you do all the SP6, ST36 and all, will be of less use, because here the dominance of the liver is there. And in such cases, it bypasses the energy flow that has to go to the fire element, that is heart. So heart will get the deficiency. Heart is a fire organ. Then what it will do? It will try to demand the energy from the kidney. Already kidney, if it is having shortage, if fire is also joining, fire demands more in order to sustain, the body will definitely, kidney will definitely prefer to give some, share the energy to the heart, because it's a vital one. The BP, anemic level, all those things are controlled by the kidneys metabolically. So what it does, again, the in of, this is a fire, this is a water. So the water dries up. What happens? Again, in deficiency will come here. Chi deficiency also will come as per the TCM. As per the modern medicine, what will happen? Because of this, drying up, they will have renal stones. And the excess heat of the kidneys will also impact the urinary bladder. So they will distend. In case of ladies, it will have the white discharge and other related uterus as well as the ovary issues. So it is a chain reaction that is happening. We need to understand into various angles. We'll have to look into various angles before just coming into a protocol. That's what I initially said. Protocol, only 4 or 5 points, common points I have given that you all know. Normally we will choose the frontal arm, that is front move, back shoe and source point, or other 5 element points depending upon the conditions that you will take. In addition to that, we will have to look into various cases, various involvement of metabolic activity, and also as per the TCM, various patterns that is impacting on the liver or the wood element. Then we'll have to make the protocol accordingly. Okay. Thrombopoietin, thrombocytes are the platelets. So the liver produces thrombopoietin, involves in the thrombopoietin. Kidney produces erythropoietin, which promotes the red blood cell production, and liver involves in the thrombocyte production through thrombopoietin, which acts on the bone marrow, on the stem cells, and influences the hematopoiesis, that is production of the blood, in that specifically platelets. That's why it influences the clotting mechanism, blood clotting mechanism in the body. And then IGF-1. Synthesis of coagulation clotting factors. So clotting factors like 1, 2, 5, 6, 9, 10, these are all the clotting factors. I'm sure definitely acupuncturists may not be having any idea about all those things. Let us not go so deep into that, because it's a chain of various activities. Various hormones are involved, various vitamins are involved, various proteins. Synthesis of fibrinogen, fibrinogen, prothrombin, thrombin, all those things are in antithrombin. Antithrombin is involved in, these are fibrinogen, prothrombin are involved in making the clots when the blood is leaking due to any trauma, accident, or some reasons. When it is leaking, in order to stop the blood loss, the blood clots are formed and it is blocking any further loss of blood. And antithrombin is the reverse of it. Whatever the clots which are not further required by the body to further hold any leakages, there is no leakage at the time, automatically this antithrombin will be secreted, and this reverses the process. So all these things are automatic, controlled by autonomous nervous system. So we'll have to be thorough with the autonomous nervous system's role in each and every aspects. And this also produces the antithrombin and fibrinolytic proteins. Lysis means destruction, anything. So fibrinolytic means fibrin. Fibrins are involved. Profibrinogen makes fibrin. Prothrombin makes thrombin. Then only the clot comes. These fibrinolytic proteins are like antithrombin and all, they reverse the clots. They destroy and gradually reduce the size and finally clears the blood clots there, whichever not needed the body to safeguard any leakages, because there are no leakages. So, what are the tests normally that are used in modern medicine to diagnose any health issues of the liver? Normally, liver function test, the primary one, which is having SGOT, SGPT, ALP, alkaline phosphatase, bilirubin direct and indirect, albumin, globulin, and then ratios between these two. And normally under imaging, ultrasound we will take. If at all any problem is there, then we will go for either CT or MRI or even the fibro scans, very rarely. Biopsies normally we will do if we suspect any cancerous tumors. Any tumor is there, just we want to ascertain whether it is cancerous or non-cancerous. In such cases only, we will go for biopsy. As an alternative medicine practitioner, I strongly advise not to go for the biopsy, not to prick, pierce and damage the protective cover of the natural immune system that contains the malign cells or the tumor, cancerous cells inside the tumor. When you do that, then you are just opening it up and all the cancer cells are now out freely through the lymphatic drainage as well as the blood supply. It reaches everywhere and causes metastasis. So biopsy. But as far as the modern medicine is concerned, only way to identify whether it is a cancerous or non-cancerous is only biopsy, to study the cell, pattern of the cell. There is no other system in which we can 100% say that this is cancerous or this is non-cancerous, benign or malign. Leave aside. Then a regeneration ability of the liver. What is a unique organ having the capacity to regenerate itself up to 70% of its mass after injury or surgical removal. So this is the reason why even after the damage of 80% of the liver, you will not get to know any symptoms. So what this denotes is that it is good that it can regenerate. As it is regenerating and also fighting the root cause which damages the liver cells, as long as it can pull up to 80% of the damage, you will not get to know any symptom. Nowadays, you see common problem that related to the liver nowadays in almost all the scans, commonly that we see is fatty liver of various grades, mainly grade 1 or 2. We will see all those things in the forthcoming slides. So the clinical correlations generally, that is what all the diseases that can affect the liver. One is commonly cirrhosis is at the terminal stage, end stage, almost irreversible condition. It's a chronic condition. It's not all of a sudden the chronic, no, the cirrhosis will happen as acute cirrhosis, cannot be. Acute failure may be there, but acute cirrhosis will not be there. It's a chronic condition where the liver tissues are permanently damaged. So when the hepatocytes are permanently damaged, they cannot perform their normal activities, metabolic activities. So once cirrhosis comes, modern medicine advises only transplantation, liver transplantation. Whereas in our clinic, we have reversed the liver cirrhosis almost within 30 days. Hepatitis, whatever the diseases that we treat, it must be an integrated holistic one. If we ask only with acupuncture few points that no, we can do, definitely we cannot. That we will come afterwards. Second condition is hepatitis. Hepatitis of A, B and all. So where the liver inflammation will be there, mainly caused by the viral infection. So taking antibodies and increasing the immunity, reducing the load on the liver should be the approach to address hepatitis. Fatty liver is the most common one, wherein excess fat is accumulated over the liver and it damages the normal functioning over a period of time. This takes, various grades are there. It takes slow process. Again, it's a chronic condition. Jaundice is excess of bilirubin. It can be due to two reasons. We should not always consider that the liver is the culprit in case of jaundice. If you see excess of bilirubin, already we have seen that bilirubin is the byproduct of the RBC breakdown. If the RBCs are broken down prematurely, already we have seen 120 days is the normal lifespan. If the RBCs are broken down before to that, no period, whenever it comes, destroy. Spleen goes left, right, center and kills all the RBCs, destroys. So here the production of the bilirubin is more than the normal one, which the liver finds it difficult to handle under the regular normal condition. That means a liver is functioning to its maximum level in an optimum level. There is no problem. But the destruction of RBC is so high and the bilirubin production is very, very dangerously high. This happens in almost all the cases of thalassemia patients. Thalassemia is a condition where there will not be any blood production in the body. It's a genetically transmitted disease. Major, minor, alpha, beta, various categories are there, wherein the patients are depending on the external blood supply or the blood transfusion. So every 15 days or 1 month, 1 unit, 2 unit, or depending upon the body weight, height and the condition, the blood every regular frequent intervals, the blood is transfused, given into the body. And as soon as external item, whatever it comes, body first initially it considers that as the foreign object only, if it is not produced within the body, even if it is the same blood group also. If you ask a C or experience the persons who are getting the blood transfusion and all, normally they will have, if it is not fully treated with blood, white blood cells and all, packed RBCs, if that is taken with others also, then they will have the fever and all. Immediately after the blood transfusion, thalassemia patients will have the fever because the body innate immunity will fight with that. So here what the spleen does is to handle this every month or every fortnight, whatever the excess blood that is coming inside, to manage that, and it goes and fires and breaks down these RBCs fully, causing premature hemolysis. That is called premature hemolysis. That is destruction of RBCs. This will lead to anemia. If you see anemia, then immediately don't jump into, say, vitamin B12 or iron deficiency and give some supplements and all. Further, that will worsen the spleen. So in such cases, already because of excess handling of this blood transfusion, splenomegaly will be there in such patients. Splenomegaly. Megaly means bulky or bigger in size, or inflammation.
Enlargement.
Enlarging. Splenomegaly will be there. Or if a patient who is having whether thalassemia, most of the guys will be having because of this mechanism, splenomegaly will be there. Or due to some other conditions also, if the splenomegaly is there, then automatically the RBC destruction, premature hemolysis will be there. That will produce more of bilirubin, which normally could not be handled by the liver to detoxify, and the bilirubin, direct and indirect, especially indirect, will be more in such cases. So you need to look into direct and indirect when you are looking into the bilirubin of the liver function test. It has got its own importance in this angle. So you will have to look into the spleen also when you see the jaundice. You will have to take the history of the patient, whether any blood transfusion taking place, or why the hemolysis is happening, why bilirubin is produced more, handled normally, produced more, or produced normally, handled less. In such cases, there will be excess of bilirubin in the blood, which is a dangerous one. And then liver failure. This is the condition where the hepatocytes lose its capacity to perform the metabolic activities, maybe due to some medications or mainly medications, acute condition. Chronic is because of various reasons, internal or external reasons. Carcinoma is cancer. Hepatic is liver. Liver cell cancer, that is liver cancer. This is one of the deadliest cancer, as liver involves in the detoxification activity and maintains almost these many metabolic activities. Any problems there in the liver itself, because he is the protector of the body. When the protector himself is in trouble, then God save the body. Oh, it's a very serious condition. In metastasis, if this happens, then almost it will be certain that the person cannot be saved. That will lead to multiple organ failure. So almost more than 1 hour now. It's a huge topic to be covered. So next week we will continue with the diseases of liver, both related to the modern medicine's view as well as the TCM aspect, because we need to have a complete detailed explanation and the understanding. Then only you will get the full benefit of the session instead of just
Yes, sir. Agree.
that
Agree, sir.
or
Very nice explanation.
just taking the screenshot alone is no use. You have to understand. Otherwise, I can just paste the material there. It's nothing. It is there in the book. But how we approach, how we correlate, what are all the intricacies or combinations that is involved in that? That we need to understand and identify. So we will have a detailed discussion about this. And if you have any problem related to this, that is liver diseases, you can just send the scan reports in the group, that BAPS free TCM classes group, or any case studies or any cases where you are able to solve it very nicely or struggling to solve it, unable to find the solution and all, put there in the group. Everyone, including me, in the learning phase only. Every case for us is a study, because for each and every case, we'll have to do complete root cause analysis. We'll have to do complete research. We'll have to analyze various things. And especially if you have to handle the liver, then you'll have to, even the psychological disorders you need to check. As I told you, in Tamil they say, Pittam, Unmattam, Paityam. These are all the stages of the mental disorder. Paityam is insane, insanity, pagal, almost out of mind. We cannot say pagal, out of mind, or it's beyond normal stage. Unmattam is a in-between stage. Pittam is the one, pitta. Liver is involved. So wood element, if you see the gallbladder's channel that passes through, that is the channel with majority of the brain is covered. It influences the emotions. As already we have seen, that's what I was repeatedly mentioning about the parasympathetic and sympathetic nervous system. So they are altered due to various composition of the neurotransmitters that impacts various conditions, including the hallucinations, including the other psychosomatic disorders, including brain disorders like Alzheimer's or the schizophrenia conditions, so many diseases. How it is that and all, if you come across with any, or if you have got any patients with you, just put forward there in the group, then we will have a detailed discussion. Because if something is there around that, I can give you more explanation on specific conditions. In schizophrenia cases and all, within 2 days, we could just reverse. Normally, we will not take 2 to 3 days maximum to reverse that, coming out of that hallucination and all. Max. And all the psychotic drugs and all, we will take out gradually, we will taper, not maximum 7 days, irrespective of the age. But of course, Alzheimer's and other things and all, that is cerebral atrophy and all, will take a long time. Even for that matter, Parkinsonism will take a long time. But the involvement of the wood element, mainly the liver, is there to a greater extent in that. So it is not only related to the metabolic activity, but also the psychological one and also the brain related one. So we'll have to have complete holistic approach. If the liver is impacted, the person will be having irritability more. If irritability is more, then sympathetic activation will be frequent. In such cases, heart will also get impacted. Lungs also will get impacted, because there will be only shallow breathing. There will not be any deep breathing. And the heart rate will be more. and the stroke volume will be less because you are not giving enough time for filling of the ventricles. So if you check the ejection fraction, if it is less than 50, then you don't jump into just the heart. Without a heart is only a very innocent guy. It responds only to the neurotransmitters coming from various parts of the body, which is regulated mainly by the liver and the kidney. These two guys are managing that. So we'll have to have these kinds of various different approaches. So if you come across, or if whatever the doubts, if related to the wood element, mainly the liver, if it is there, put there in the group, we will have a complete discussion about the etiology or the likely pathophysiology of it. And accordingly, we will have to make the protocol. So now you will understand about why I have told at the initial stage that, we have come here to get the protocol only. If you are not giving the points, then what is the use in attending the class? Who want all those gyan? We don't want any gyan. You say for this condition, this many 10 points. For that condition, this many 10 points. The disease will be cured. Waste. Then you are not even a therapist. We cannot say that, healthcare provider. No, not even a therapist. For that, no, these kinds of elaborations are not needed at all. So you want to cure a disease, address it from the root cause. You need to understand that.
Differs from person to person.
100% based on their experience, knowledge, the cases they have handled, the books they have studied. I request you to constantly, we are trying to give you maximum possible short sessions like this in the free sessions. Even we are conducting, paid classes also. That's very limited. This general classes, free classes will be on various general topics, which normally, because unlike the MBBS or the Ayush guys who study 5.5 years, 4.5 years, they study the complete anatomy, physiology, etiology, everything. Only they study there. Afterwards, they are going doing the internship, and then they are coming and practicing. Whereas with now hardly 100 hours or 50 hours, 20 hours. So many guys, MD acupuncture. How many hours you attended? How many cases? How many pulse you have checked? Or what many books you have studied? Nothing, sir. This is all what you are talking about. Just one page liver, katham. One page gallbladder. Anatomy, physiology over, like my slides. But each and every line, I advise you to go through. If you want a good book to refer, BD Chaurasia. Chaurasia's book is considered to be one of the best book, and all the MBBS guys, all the medicos, they are using this only. The book I just share here, you can see.
Sir, can you share that book?
A book I not only just I will share you. It is there in the net and other things. You buy the book instead of paperback only is good. You study, turn the pages, underline.
But if you're not in the country, it's hard to.
What is the heading of the book, sir? Book
That
heading.
I'm sharing you. I'm sharing you.
What is the heading of the book?
BD Chaurasia's Human Anatomy.
No, that's author name. Author name. Author name. The title of the book.
That's what. There are so many
2 volumes.
No. Total 5 volumes are there.
Oh.
So whatever the pictures and other things that I was showing is in volume 2, abdomen and pelvis.
So this is modern medicine based book.
Yes.
Huh?
Yeah. Anatomy and physiology only, modern medicine only you can study.
Correct. But
Yes, sir,
it's not no relevance to the TCM or anything.
Without
Yes.
understanding this, if you study the TCM, you will not understand head or tail of it.
Correct.
Okay.
Without modern medicine's knowledge about anatomy and physiology and etiology, TCM knowledge will be big zero. That's what. Then you will do only getting the points from someone, protocol. Sir, liver pain or the jaundice, what are the points? Someone say liver 3, and then liver 8, and then UB 18, UB 19, and then liver 13, 14, GB 24. With that, they will go.
You understand the logic. Understand the logic behind
Not
it.
only logic, that's what I said. The liver's problem is one, not the liver's problem alone. It has got the root and other
Various.
things with connections with various things. Without connecting or addressing that, that's what I said. Without addressing kidneys indeficiency, you cannot address liver yang excess or empty fire of liver. You cannot. Even if you put sedate liver 2, increase liver 8, you can do whatever the jargons that TCM's the thing, perspectives of no use. Because you have not even there also understood that properly. The flow of chi or various cycles, generative control, insulting, various. So you need to have at least try to read more, try to discuss more, use our platform. That is Bab's free TCM group there. Whatever the questions that is placed there, to my knowledge, whatever it is there, I am giving the answer there.
Sir, are there 4 volumes or 5?
I think recent one is 5. I'm not sure whether it is
Okay.
restricted to 4 only or 5. So thank you very much.
So next
Yes, sir.
Sunday,
Very
what
nice class.
time? Very good class, sir. Thank you so much.
Very nice. Very knowledgeable.
Thank you very much. Thank you.